Edward, it's nice to catch up with you, hiding behind the mask there. You've been keeping me posted from a distance about your recovery. It's now almost 4 weeks, you were saying, since...
Yep, 4 weeks.
So, yeah, nasty knee injury, multi-ligament injury. This is Edward Forster, nasty injury, wee rugby tackle actually, but nasty injury to the inside of his knee. I think we can see how unstable that medial ligament is. It's just gapping in there. And with regard from the cruciate ligament, not quite as unstable, but we need to check that because it's partial, at least partially torn. So we're going to internally brace all the injured. We've repaired his medial ligament, his cruciate ligament, and anterolateral ligament, and internally braced all three to accelerate his recovery. As you can see at the end of the operation, a lovely extended knee, full flexion. Most importantly though, completely stable joint, and where that medial ligament had been gapping, the knee is now protected. And ready to start his rehabilitation with Stuart. Basically three ligaments repaired. So we would expect you to be taking it very carefully just now, like on your crutches. But tell me, what have you been up to?
Been doing a bit of motor racing at Brands Hatch. So it was a 16-hour round trip to drive there, and then did a day's testing and a 40-minute pace stop race.
Wow.
With qualifying. So yeah, but it was okay actually. Once I got out of the car, I was a bit tired. But
yeah, understandably, a bit tired and a bit stiff. But
right.
During the race, you were able to get fully engaged and you weren't distracted by it.
No, as soon as you leave the pit lane, your mind is obviously on other things, and you don't notice any pain at all. It was only when I came into the pit lane at the end of the race that I could kind of feel that it was tired and getting out of the car and then straightening it again.
Okay.
The week before, I spent most of the week driving a rib, actually, about 10 days after the operation.
10 days after
and that was fine. I didn't go wakeboarding though. I gave that a miss.
Well, I already saw some video of you on with the anti-gravity treadmill about 3 weeks after surgery. You're doing very well.
3 weeks today. Nice heel strength and bend.
Just today we can see that knee's very settled. There's virtually no swelling in it. You've got good extension, and obviously your range is improving. So very unusual form of recovery, but we'll continue to monitor your progress. Okay, thank you.